Regulatory Intelligence. Welcome to this presentation on regulatory intelligence. Regulatory intelligence, RI, involves gathering and analyzing publicly available regulatory information, understanding its implications, and monitoring the current regulatory environment. This process is crucial for maintaining compliance with regulatory requirements and ensuring that product information is up to date. RI supports effective regulatory strategies and the fulfillment of pharmacovigilance commitments, making it an essential activity for marketing authorization holders, MAHs. Disclaimer. Before we proceed, please note the disclaimer. The content presented here is copyrighted by Next PV Services SRO and reflects the views of the creator. While our team leverages AI to enhance our operations, the responsibility for accuracy, relevancy, and integrity remains with our human experts. This ensures that we provide high-quality, timely, and informative content. Please keep this in mind as we move through the presentation. Content. This slide outlines the structure of our presentation. We will start with abbreviations commonly used in regulatory intelligence, followed by the background and purpose of RI. We will then discuss generalities about the process, including its importance and how it is performed. Next, we will review the key regulatory agencies and committees involved in RI. And finally, we will cover the agencies that are typically screened as part of the RI process. Abbreviations. Understanding. Abbreviations is crucial for navigating regulatory intelligence. Some key abbreviations include EMA, European Medicines Agency, FDA, Food and Drug Administration in the US, HMA, Heads of Medicines Agency, GVP, Good Vigilance Practices, MAH, Marketing Authorization Holder, MHRA, Medicines and Healthcare Products Regulatory Agency in the UK, NCA, National Competent Authority, PV, Pharmacovigilance, QPPV, Qualified Person Responsible for Pharmacovigilance, RMP, Risk Management Plan, SUKL, Czech Drug Control Agency, and WHO, World Health Organization. Familiarity with these terms helps in understanding regulatory documents and communications. Background regulatory intelligence involves gathering and analyzing publicly available regulatory information, communicating its implications, and monitoring the regulatory environment. Regulatory agencies often communicate new product safety information directly to MAHs, but more frequently, such information is published publicly on their websites. This can include requests for label updates, RMP amendments, and safety analyses. Performing regulatory screening is crucial as it ensures that product information remains current in light of scientific knowledge and regulatory recommendations. This aligns with GVP 9 requirements, emphasizing the need for MAHs to keep their product information up to date. Generalities. Regulatory intelligence is essential for an effective regulatory strategy and fulfilling pharmacovigilance commitments. Regular screening of regulatory authority websites is performed on a schedule specified by the client, such as weekly, bi-weekly, or monthly. In cases where regular screening did not cover a relevant period, ad hoc retrospective screening may be necessary. All websites included in regular screenings are also searched during ad hoc screenings. Useful resources for regulatory intelligence include websites like Safety Observer, which aggregate safety information from various regulatory agencies. Regulatory agencies and committees. Several key committees and agencies are involved in regulatory intelligence. The Pharmacovigilance Risk Assessment Committee, PRAC, at the EMA, is responsible for assessing and monitoring the safety of human medicines. The Committee for Medicinal Products for Human Use, CHMP, also at the EMA, is responsible for human medicines. The Coordination Group for Mutual Recognition and Decentralized Procedures, HUMAN, CMDH, handles marketing authorizations of medicinal products in multiple member states. These committees play a vital role in the regulatory landscape, providing guidance and recommendations on the safety and efficacy of medicines. Regulatory agencies and committees. The Heads of Medicines Agencies, HMA, is a network of the heads of NCAs responsible for regulating medicinal products in the European Economic Area. Other important committees include the Committee for Advanced Therapies, CAT, the Committee for Orphan Medicinal Products, COMP, responsible for orphan designation of medicines for rare diseases, and the Pediatric Committee, PDCO, which supports the development of medicines for children in the EU by providing scientific expertise and defining pediatric needs. These committees ensure that various aspects of medicine regulation are comprehensively addressed. Agencies screened regulatory intelligence involves screening various agencies, including the EMA, FDA, HMA, WHO, SUKL, and SUKL. These agencies provide a wealth of information on regulatory changes, safety updates, and other critical data necessary for maintaining compliance and ensuring patient safety. In addition to these, agencies like the MHRA in the UK might also be screened. Regular and thorough screening of these agencies' publications helps MAH stay informed about new regulations, safety alerts, and other relevant updates that could impact their products. Thank you for your attention. As we conclude this presentation, I want to thank you for your attention. Regulatory intelligence is a critical function that helps ensure the safety and efficacy of medicinal products by keeping up to date with regulatory requirements and scientific knowledge. Should you have any further questions or require additional information, please do not hesitate to contact NextPV. We are committed to not just fulfilling tasks, but to supporting and taking care of our clients with the highest standards of professionalism and expertise.